Good evening, everyone, and welcome to this council meeting of the County of Lennox and Addington on November 19th. I call the meeting to order at 6:30 p.m. Can I have an adoption of the minutes of the public meeting official plan update held October 15th, 2025? Deputy Warden, seconded by Councillor Fritsch. All those in favor? Motion is carried. Can I have an adoption of the regular monthly meeting held October 15th, 2025? Councillor Davison, seconded by Councillor Richardson. Any edits, errors, or omissions? Seeing none, I'll call the question. All those in favor? Motion is carried. We have an agenda before us. Can I get an approval for the agenda as printed? Councillor Wise, seconded by Councillor Calver. All those in favor? Motion is carried. Any disclosures of pecuniary interest or the general nature thereof this evening? Seeing none, you have the warden's report before you. Can I get a motion to receive? Councillor Fritsch, seconded by alternate Hook. Any comments, questions? Call the question. All those in favor? Motion is carried. We come to delegations. Frontenac, Lennox and Addington, Ontario Health Team, and I would welcome Dr. Kim Morrison to the podium.
I have to push the button, sorry. Thank you very much, and thank you very much for making time on your agenda to learn a bit more about the Ontario Health Team in our region and what opportunities exist for our citizens through this work. I thought it might be helpful to give you just a little bit of background about the Ontario Health Team and what it is and what it does, what the principles of health homes and health neighborhoods are, and then get on to what the opportunities are before us as we do this work together. So the OHT came together in 2020, which was the beginning of the pandemic, and lots of things were happening. It's kind of crazy that 5 years have now gone past, which is pretty cool. But we're made up of a collection of partners. The real work of OHTs is to bring partners together. The OHT doesn't provide any services. We bring partners together and help to try and have partners work better together to provide better care, better outcomes, better value, better experience for the people that we serve. Currently, the FLA-OHT is made up of 85 different organizations. We are really fortunate to have all of our family physicians in the region as part of our primary care network. And we have a vibrant community council made up of 25 members from our community who bring the voice of the people to the work that we do. In our history, we have organized our OHT by networks based on the kind of service that people have provided, and over time we're developing our governance model and our organizational model in order to make sure that we're providing value to our partners. I'll talk a little bit more about this in a minute, and we can really deliver on the mandate that we've been given by both our community and by the province. We landed on a strategic planning exercise a couple of years ago. We're now in the year 3 of a 5-year plan, where we went out to the community and said what was really most important. And it was really clear then, as it is now, that everybody being attached to what we call a person-centered health home is really a core foundation of a high-functioning health system. That means that every community member who wants one should have access to team-based primary care close to where they live. When we talk about health homes, we talk about a team of people. It is not just a family doctor or just a nurse practitioner. It's a group of people who work together with the person and their family at the center, recognizing that the vast majority of care is provided by people themselves and those that are closest to them. The health home is the circle of care providers and organizations that keep people well in their homes and take care of them in the transition through their lifespan and through their healthcare journeys. It's about being people-centered, it's about providing this care close to home, and it's about working in a team where every member can work at the top of their scope of practice so that we can maximize the capacity and efficiency of all different kinds of health providers that exist in our community. So you'll see here, it's about ensuring that we have access to diagnoses and treatments. It's about recognizing the social determinants of health. It's about recognizing the importance of home care and providing care in people's homes so they don't have to go to hospital. It's about preventative care. It's about mental health. It's about being able to navigate the system. There's lots of resources out there. Oftentimes people don't know how to get the care that they need. Those are all the goals of the health home, while they connect with health neighborhoods of resources that are best used not in every individual health home, but are available to multiple health homes. So that's hospitals, that's specialty care, that's paramedic care, that's advanced mental health. And being able to seamlessly connect between the health home and the health neighborhood is really how people can navigate that system most efficiently, providers can deliver the best care, and the system as a whole can really recognize and get the value out of the significant number of resources that are poured into healthcare every year. In our OHT, we developed what we called a health home maturity roadmap. I won't read all this to you, it was in your package, but it's about taking what used to be a solo family doc and turning that solo family doc into part of a health home who can work together with other practitioners, other care providers, think about things like accessibility, cultural sensitivity, understanding trauma-informed care, understanding how the social determinants of health impact people's wellness, and understanding how your role connects to the rest of the health system creates these fully mature health homes that you see here. And these are the 7 principles that we landed on, that when we reach maturity, every one of our neighborhoods will have a health home that can really embrace these 7 principles and really maintain the person at the center and delivering the care to them that they need to keep them healthy and well close to where they live. This means simpler journeys. This means improved access. It means better pathways of communication. Most of the time, people just assume that healthcare providers in their care journey know what's happening in other parts of the health system. And I must admit, I think it's been a big secret of healthcare that we have no idea. And we need better pathways of communication. We need better data interoperability. We need standards that allow information to share and be at the place where people need it so they don't have to keep repeating their stories, and improve their journeys and put them less at risk. We need increased access to primary care. By building these teams and capacity, it means that everybody can have a family doctor and nurse practitioner. There is not for lack of resources in our communities. We just aren't using them in the best way that we can. It's about people being people-centered and ensuring that there's a strong community voice. And I think one of the differences in Ontario health teams is that this has really been, I keep calling it a gift, we shall see, but I think it's been a gift from the ministry for communities to build these from the ground up. And the voice of the community member at every table is really key to designing a system that will actually meet community needs, not just what the government want or not just what the doctors want. When we talk about health homes and primary care, last December, we're almost at a year, Premier Ford announced Dr. Jane Philpott as the chair of the Primary Care Action Team with a mandate to attach every single person in Ontario, again, who wants one, to a family doctor or a primary care nurse practitioner working in a team by 2029. We're now 1 year in. We're working on it. I'll tell you about what we're doing about it. But the government is investing billions of dollars to make this happen. They are engaging across primary care providers and primary care teams and Ontario health teams and primary care networks across the province with a mandate to get this done. We're doing this in a series of funding opportunities, but we're really doing this in ways of working together as an Ontario health team to bring providers together who never needed to talk to each other before. So in our Ontario health team, as I said, we have 160 family doctors. They're divided into about 16 groups at the moment. And we have a group that meets once every month that includes the leads of each of these groups. And they all come. And they come because working together, we realize we can do our jobs easier. And working together, we can actually achieve this mandate of giving everybody attached to primary care by 2029. Our OHT did put together a proposal of how we had, in the last data count, there were just about 30,000 unattached patients. Our OHT straddles from Deseronto to Gananoque and up as far as north as Denby, as far north as North Frontenac and Addington Highlands goes. Our data would suggest that we have about 30,000 unattached patients. 5,600 as of March 31st, 2025 are in Lennox and Addington County. And our plan over 3 years was how to attach all 30,000 of those and what were the resources that we were going to need in order to, one, build teams that primary care family doctors and nurse practitioners could work in, and second, would create those teams that would make recruitment of family physicians, nurse practitioners, and other allied health positions so great that we wouldn't need to pay doctors to come. We wouldn't need to pay nurse practitioners to come. We would create teams that people wanted to come and work in. And we're doing this work. There's various rounds of proposal. As you know, nothing happens in government very quickly. We submitted our proposal for the whole. This is how we can do 30,000 people, and this is what it's going to take. It was about $11 million. We submitted that in April, and in the summertime, they came back and they approved us for $1.49 million with a commitment to attach about 3,500 patients. So it's about 10%. At first, we're like, oh, wait a minute, that sucks. Excuse my language. But in retrospect, it really allows us to do this piece by piece. And it's realistic targets and allows us to build one upon the other about how we will get to our full attachment within 3 years. We had already, with our primary care network and across our partners, started to do this work. In 2024, so before the primary care action team was set, by the work of developing health homes and the work of working together and through our primary care council, our primary care network, and the Ontario Health Team, we'd attached over 13,000 people. The key enablers to this were really a shared vision. What is a health home? Why do we want to participate in being in health homes? And what is the value both to our community and to the people that work in the system? We needed a coordinated attachment process, and we have been really fortunate to work with Healthcare Connect, which is a program of Ontario Health at Home, about how to keep track of who needs a family doctor or nurse practitioner and how to create those attachments to these health homes. We also knew that we needed strong data and strong referral systems. The progress that we've made, again, you can read all this here, these are the ways that we have provided more access and more attachment across our community. We've built access points for pregnant women and for babies. We've built a brand new health home in Kingston. We've consolidated resources in Napanee to form the Greater Napanee Health Home with a combination of the doctors that worked in Napanee, the community health center in Napanee, the hospital, and then the town of Greater Napanee. That partnership has been able to create a model of care that allowed us to attract 5 new doctors in 1 year. We've attached over 4,000 patients during that period of time. That's huge. You can read the rest of the things that we've done here around access and attachment. Digital innovation, as I talked about, the ability for people to communicate across their health sectors has never been more important than in today's world. It is important that people are empowered with their own health information. It is important that providers have the information they need about the patient in front of them, and we need to ensure that we've got pathways to allow that to happen. So we've done work with centralized intake for a program called Access MHA, which is a one-stop shop for mental health resources. No longer do you need to think about, do I need to go to Resolve? Do I need to go to Pathways? Do I need to go to MaltB? It is a one-stop process through which either a primary care provider can make a referral or patients can make that referral themselves. Excuse me. We assist primary care providers and their patients with tools such as online appointment booking, which is now active in over 30 of our practices, and digital innovations like AI scribes that make the administrative burden just that much easier, which allows family doctors and nurse practitioners to see more patients. We can't do this at the expense of quality, and we have an entire organization called our Quest Group, which is the Quality and Evaluation. It's run by Queen's University, and it's important that we're being able to know what we can measure. We need to know what impact we're making, and we do that through stories and through data. We have integrated pathways to consolidate how chronic diseases such as chronic obstructive lung disease and congestive heart failure are managed. Diabetes and hypertension are next. As I talked about, we have consolidated mental health and addictions pathways, and we have new pathways for palliative care so that people at their end of life and their families have the most coordinated, most accessible services that they can. The road ahead, as I talked about, the North Star is to everybody attached to a family doctor or nurse practitioner working in team-based care. We now have the data available to us through partnerships with the county, with public health, with Ontario Health, to truly understand who the people are, where they live, and what their needs are. We're able to now extract data based on either FSA or ADA or all of these other census nomenclature about what area do people live in. It is not good enough to say Lennox and Addington County has 5,000 unattached people. We need to know that in the neighborhood in the north around Northbrook has 3,000 people or 2,000 people, and these are the kind of conditions that they have so that we can tailor the resources that are needed to keep people well there to their particular needs. The needs of downtown Kingston and Denby are very different, and we now have the data to be able to inform that, and we can match the current services that are there, identify the gaps, and then work together to fill in how to fill those gaps. This resource modeling has allowed us to create in our next submission to Ontario Health exactly what each region needs and in which part and parcel we're able to do that. As I said in round one, when we submitted the proposal for the whole OHT over the whole continuum, we were able to pare it down to the 10% that we can do a lot of good work with. At the moment, we're using that 10% to target first our areas of our OHT that have the highest unattached numbers. The ministry identified those to be the west end of Kingston and the north part of Kingston. As an OHT, we made the decision that we would build on capacity where it exists. So we know there's a little bit of capacity in Napanee that we've been able to maximize. We worked with family health groups in Kingston where they had capacity, and we're ready and able to right now recruit new physicians and hire new human health resources in order to fill that need. So through this work, our 3,500 people will be attached to those existing health homes. In round two, which we submitted on Friday, we now can turn our attention to more difficult areas, where we'll turn our attention to the rural areas, so north Lennox and Addington, the rest of Napanee and Amherst View, and north of Kingston, which didn't receive any of the funding from the first round. This group will establish an integrated team that will exist in multiple places. We need a hub in the north for people to be able to go to. We need a hub in this west part for people to be able to go to, where they can come and access the care and get caught up on all of the things that they haven't had for so many years when they've been unattached for so long, and then be ready to connect to one of the family doctors or nurse practitioners that exist, and building these teams that will then allow us to recruit more people to do this work that we're doing. So our proposal that went in on Friday was for $3.3 million to attach around 8,000 people in those regions that I talked about. We are hopeful that through the work that we've been able to demonstrate to Ministry and to Ontario Health that we've already done, through the partnerships that we've built across our OHT with various partners, municipalities, hospitals, primary care, community agencies, home care, community paramedics, the list goes on, that we've been able to demonstrate in Frontenac, Lennox, and Addington the power of partnerships and the powers of collaboration. We can demonstrate the value of integrated and team-based care. We can promote the digital technologies that will help us all do our work better together and empower patients with their own information. And we have the data to understand what are the human health resources that we need to move forward. This is novel work that has never been done at a primary care level before. It is shocking to me. We have human health resource ways to understand business, but we don't in healthcare. We simply don't. As part of this work, we have been doing work on revising our FLA OHT governance structure. We spent some time thinking about what incorporation would mean about a year ago. Then the government changed their mind and said, no, don't do that, go away. But we used the opportunity to meet with all partners, including the county and our municipalities, to say what do we need to do in order to ensure that this is valuable to us and that you can bring value and not make best use of the resources that we've got in an OHT structure. So we're in the process of consolidating all that information. We've gone back to what we've called the Transitional Leadership Collaborative to date. We are just at the point where we can redesign that collaborative decision-making agreement that we had at the beginning to be truly inclusive and represent the voices of true communities across our OHT. That's the work ahead. It's lofty. There's a lot of it. There's so much more information if you want on our website about the various programs that we've done, but I'm happy to answer any questions.
Thank you, Doctor. I'll turn to Council. Any questions for Dr. Morrison? Councillor Wise.
Yes, thank you. Through you, Warden Townend. Hi, Kim.
Hi, John.
Nice to see you. Do you ever sleep, Kim? Or
I try.
You're like You're like that bunny in the commercial, it seems, that it never
It's
stops.
funny, somebody just sent me that picture,
Oh,
like
is
quite
that
literally.
right? Okay. So can you compare and maybe contrast a patient experience of someone who's unattached but is now brought into a health home situation? Maybe they've got multiple problems, maybe they've got a heart condition and beginning of dementia, and maybe some social issue. What would their experience be in this new model compared to what it would have been 10 years ago, for example?
Yep, for sure. So somebody like you describe, who might be lucky enough to know somebody who knows somebody to get them into their family doctor, would then come and meet the family doctor and have a history taken and a long list of problems identified, a whole bunch of referrals made, and then people would wait for all that stuff, things to happen. In a health home model, especially with our unattached work, you can come immediately and you will be seen by somebody on the team. It might be a nurse practitioner, it might be a nurse, it might be a physician, but it might not be your forever physician. And as part of that team, you also have social workers, navigators, other nurses, respiratory therapists, physiotherapists. So from your list of things that need to be addressed, lab work can be ordered, chronic disease nursing can be implemented, so you could go talk to somebody about your diabetes right then and there. The physiotherapist could then address your arthritis problem, and you can be seen by a multitude of people right within your same primary care practice who are all connected and all see the same information about you. When referrals to that need to be made, if they do, outside of that to the health neighborhood, to a specialist or to an acute care hospital program, those referrals then go from the team to that most equipped other team, but seamlessly through digital innovations and connected records so that you don't have to repeat your story when you get there. They've got all the information about you and the asks are very targeted. So it's more efficient. I would like to think it's more patient-centered because most of your stuff happens right there and it's way timelier.
Councillor Fitch.
Yes. Through you, Mr. Warden. Yes, Kayla, I have a question here. Maybe it's more of a higher level question. Do you know where they're at to create a province-wide health records management system?
Isn't that the billion-dollar question? I know that there's, ROHT has been one of what they called the initial 12. So there were 12 OHTs identified about 18 months ago as more advanced as the other 46. There are 58 across the province. And as part of that I-12 group, we've been fortunate to be part of the digital and data tables that are talking exactly about this. I would love to tell you that there's a plan in place for that to happen. There isn't. What they are talking about, though, are ways to bring systems together so they can at least talk to each other. They call them portals of portals, which sounds complicated to me, but maybe the IT people understand it a little bit better. But there is work being done to ensure that the systems in which we currently work can at least talk together. There is a platform called Connecting Ontario that everything is supposed to feed up into, which exists at the moment for home care, labs, pharmacy, and hospitals, but has yet to include primary care, which is the place where the vast amount of care happens. There's a lot of work to be done about who's going to pay for it, and that seems to be the limiting factor, because it's not going to be inexpensive. We know in this region, the 6 hospitals that were made up the Southeast LHIN have just implemented a new shared health information system to the tunes of almost $200 million, and that's just for hospitals and some community services. So the price tag is huge, but the willingness of partners to now come to the table to say, what is it actually going to take? We keep thinking it's too expensive, so we won't think about it. But there's now willingness to, when we realize that systems talking together just isn't going to cut it, it makes moving towards what does one system look like that much more, at least, visible.
Yeah. Thank you very much. Appreciate that response. When you just think about it, though, like if the huge costs are created, but if it was created, the savings should be phenomenal in far less wasted time, the time wasted or the inefficiencies, right? Exactly. Huge gains.
100%. And I think healthcare providers have been saying that for a while. I think we really need a community voice to say the current system is not acceptable. And the more voters together that say that, the more I think that it will be higher on the provincial agenda. Nova Scotia is currently implementing a one person, one record. They're going to prove that we can do it.
So do you think a political push would be of some benefit?
I do.
Okay, thank you.
Alternate Hook.
Thank you, Warden. I have a timely question. We hear on the news that there's a lot of Quebec doctors not too happy with, I guess, the money they're receiving, and there's some interest in Ontario. Is there anything that a local family health team can do to tap into these doctors, or how do we know what to do?
Yeah, an excellent question. And this is one of the work groups now of our Ontario Health Team, is to do this work together. There have been local teams in Kingston that have gone through the process, not only for doctors coming from the US, because there's a lot coming from there right now too, but Quebec and a large number of internationally trained doctors, even Canadians who have trained internationally, who want to come back. So our colleges are making pathways to ensure high quality, but make those returns a little bit simpler. And it's a lot of work to do that work, to bring in a doctor from another country. We have, as part of our health home human health resources planning, a group that includes people who can do this work. So the County of Frontenac has been really involved in this. The City of Kingston has been really involved in this. There's a group called the Eastern Ontario Recruitment Organization. Currently across our OHT, we have 3 different memberships. That's kind of dumb. I think we could just do all that together. And as an OHT, a doctor coming to Napanee helps the whole system. A doctor coming to Kingston helps the whole system. So the work that we're doing as an OHT is to bring that together. We have a single web page where all of the current opportunities for people to come and practice exist. And our goal is to map that onto all of the other recruitment sites so that people know that we're here and we're open for business.
Other questions? Deputy Warden.
Thank you, Warden. Through you. I think I've got 2, unless the one gets answered, if it gets answered together. Since reading our package and the information in it, I did do, it did trigger me to do some research and everything. So the first question I have is, from what it appears and what you hear on the street or on the news, it seems like some of the disciplines in the healthcare aren't fully utilized to the maximum of their ability. And like a nurse practitioner, they've been given so much authority to be able to expand what they do. And from what I saw, I was just wondering, could you confirm, does the new system, is it set up so that all of the disciplines can work to the maximum of their capabilities and of what the discipline allows them to do?
For sure, and it's an excellent question about capacity and teams. So by bringing all kinds of providers like nurse practitioners, social workers, respiratory therapists together in one team, it really allows that team, when a person presents, to decide who is the best person on that team to address that person's needs in the moment. And our ability to then bring in other parts of the team, be that home care providers or be that community paramedics, to support that team so that everybody can work at the top of their scope of practice, and we all understand what people's scope of practice is. Never having worked in a team before, I actually didn't know what a nurse practitioner could and couldn't do. Now that I work with a nurse practitioner as part of my team, I'm like, this is great. And I know from speaking to the nurse practitioners, they feel the same way. There are nurse practitioner-led clinics, and they benefit from working collaboratively in a dyad model almost. That their scopes are not the same, but they shouldn't be siloed. So by bringing them together in these teams, I think it allows us to gain the efficiency that we need, given our human health resource shortages, to meet the exact need.
Perfect. I believe that empowering every level, every discipline to be able to work to the best of their ability, I think that would create huge efficiencies in itself, so that's good. I just have one other question, Warden. and on one of the slides here, it shows the roadmap, and it has the different steps that would go from a primary care to a fully mature health home. Is there a time frame that is expected for that roadmap to be completed, or is it each group may mature at a different rate?
So the nuances of primary care is that from inception, like John was talking about 10 years ago, family doctors were entirely self-employed business people. They got paid by the government to do a job, and they could do it in the way in which they wanted to do it. What we have changed is the ability to work in teams, and it brings a level of accountability to primary care that was always inherent, but never really explicit. So the roadmap has been designed to provide the tools for practices to work towards a mature health home and realize the benefits of that. Life is better when I work in a team. Life is better when I have a model that allows me to go on vacation and not worry about who's looking after my patients and check my inbox while I'm gone. Life in a team means that I can share practice loads, and I can look after the sickest people, and my nurse can look after well babies. That's all part of that maturity roadmap, and there's a certain amount of change management for me to learn how to do that, to give up some of that, and for other parts of the team to really step into these roles. And as we talked about, working, that's what makes people happy, is working at the top of their scope of practice and being able to do all that they were trained to do. So the roadmap for sure is a coalition of the willing. We have no sticks to make people work in this way. We can only incentivize what we're trying to achieve and give people the tools that they need to do it, and trust and hope that they see the value in that and choose to work together to do that.
Thank you.
Anyone else? Councillor Richardson.
Thank you, Mr. Warden, and thank you, Kim, for being here. I think I'd be remiss if I didn't ask if you could relate to council some of the successes that the Napanee Health Home has had, and I know that you're very proud of that, and so are we in the town of Greater Napanee, but if you could relate some of the successes we've had with respect, that'd be great. Thank you.
For sure. So the partnership that we have built in the Greater Napanee Health Home between the town of Greater Napanee, the Napanee Area Community Health Centre, which is part of Kingston Community Health Centres, the Mighty Docs Fo, which is that group of disparate doctors who were all business people before we did this, and the hospital, by coming together in a single model, we've transformed the way we work into a salaried model for physicians, which means they can have pension and benefits. Paternity, maternity leave was a big thing that physicians really didn't have before, and bring a quality of life to their work that makes them want to come. We together as a group care for the group of patients and are able to say that if you live in the town of Greater Napanee, this is where you can come and you will have a family doctor or a nurse practitioner to look after you as part of this team. We have been able to attach over 4,000 patients in the last 16 months. We've recruited 5 new family doctors and 2 new nurse practitioners, with 2 more coming. It has been such an exciting time to be able to say, this works. We've seen a decrease in the number of unattached patients coming to our emergency department. We were running at 40 to 45% in December 2023, and we're now down to under 20%. The challenge is, of course, of when you become a more efficient emerge department, is more people come, and they come from further away. There's nothing I can do about that. But the number of unattached really speaks volumes to the way in which people can move through the emergency department, and the way in which we hope we will be able to demonstrate the population health benefits that we know we have data for, but we're a little young to be able to say we've decreased the rates of this, that, or the other. But the camaraderie that exists in our team simply wasn't there before. We had 4 family doctors leave practice family medicine entirely in 2023. It was a really sad day. And now we have residents and trainees looking to come and work for us. It's pretty great.
Great, thanks, Kim. I always love hearing those stories, so thank you.
Hey, Dr. Morrison. Yep, Councillor Wise.
So I have to ask on behalf of a resident of my vintage whose doctor, I think she didn't have a doctor locally in Stone Mills, but lost her physician to retirement, regularly inquires of me, when is this health home thing coming to Stone Mills Township? What do I tell a person like that?
I would love that we would have a Lennox and Addington health home. Part of the work is, as we've spoken about here, is the coalition of the willing. And we want to make sure that we make use of the current providers that are there and try and build that value proposition of what does it look like to work together. I can tell you that the work in round 2 that I spoke to puts a hub in northern Lennox and Addington that would meet the needs of everybody outside of Napanee who currently doesn't have a hub. And that would be a central place of allied health resources, intake for people who have yet to be attached while we can recruit more people to the practices that exist there, or bring family physicians who want to work in that hub as a new practice. But that's the hope of round 2, which apparently we're not going to hear about till spring. But anyways, I don't know why you have to submit in November and not here till spring. But anyways, I'm hopeful that the rural hub in the north is going to give a health home to the rest of Lennox and Addington. So if you know your MPP who can vie in for this, that might be a good thing too.
Good luck. When we had the public health merger, we had to submit the business case in spring and didn't hear till December, and you merge in Jan 1, so.
Crazy, right?
It takes time.
Imagine if you guys worked this way.
Anybody else? Yeah, Councillor Calver.
Thank you, through your warden. Kim, absolutely fantastic work you guys are doing. Being gotten into one of the new doctors right at the very beginning of things, I can't speak, just amazing job you are doing. It's wonderful, and like you say, the doctors that are coming are happy. You can tell that when you see them. And I just want to thank you and your team for everything you've done for us. Thank you.
Thank you.
Anyone else? Can I get a motion to receive the presentation, I dare say with thanks? Councillor Calver, seconded by Deputy Warden. Any further discussion? Call the question. All those in favor? Motion is carried. Thank you, Dr. Morrison.
Great. Thank you very much for having me.
All right, matters for consideration, the strategic planning update. I'll turn to the CAO.
Through you, Mr. Chair. Well, as we do every 6 months, we're bringing back to you our strategic action plan. So just to refresh your memories, we did our strategic planning in spring of 2023. So we're 2.5 years into our action plans. And again, this is your update. So any new text added is in red. The status symbols, as we wanted to make it easy to read and so you could flip through. So you can see if something is delayed, it's yellow. If it's stopped, it's red, and with explanations. And I just want to thank all of the department heads for their work, not only in keeping us on track with our strategic action planning, but for providing all of this detail for you. And we are all happy to answer any questions that you might have on any of the content.
Would turn to council for any questions on the strat plan update. Councillor Wise.
I have no questions. I just wanted to express my pleasure on seeing how much has been accomplished on the plan. You know, it's been a while since we went through the exercise, and each report, there are more green lights and fewer yellow and red ones. And I was particularly pleased to see how many things aren't just done, but are ongoing. These initiatives have been incorporated into the process, the operational processes and policy-making mechanisms of the county. That means that we've created institutional change, and that's the idea, I think, fundamentally. So congratulations to staff.
Thank you, Councillor Wise. Others? Can I get a motion to receive then? Councillor Wise, seconded by Councillor Davison. Any further discussion? Call the question. All those in favor? Motion is carried. Roma delegations. Over to the CAO again.
Through you, Mr. Chair. Well, this year we missed the window for the notification of submitting for delegations for Roma and the closing date. So the notification to submit was after our council meeting last month, and the deadline was yesterday. However, you'll see in the report, staff have no delegations to recommend to council, but if you did wish to try for a delegation, we could submit it late. And I talked to our MPP, and he said he would be willing to advocate to whatever minister might be relevant for something that we might want to submit for a delegation. We're happy to do whatever council wishes.
Council's wishes? Unless there's any suggestions, I would seek a motion just simply to note and receive the report. Councillor Calver, seconded by Councillor Richardson. Any further discussion? Call the question. All those in favor? Motion is carried. Multi-year accessibility plan. To our clerk.
Thank you. Through you, Mr. Warden. So this is our multi-year accessibility plan that has already gone to our Accessibility Advisory Committee for their approval. They did not have any feedback. You'll see we highlighted any additions or changes to it. This is a mandatory document under the Accessibility for Ontarians with Disabilities Act. So we're looking for any feedback from council this evening or your approval. And I'd be pleased to answer any questions council may have.
So I'll turn first to council for any questions. Seeing none, what are council's wishes? There is a recommendation. Deputy Warden?
Move to receive and adopt the recommendation.
Move to receive and adopt, seconded by Councillor Wise. Any further discussion? Call the question. All those in favor? Motion is carried. Joint Accessibility Committee membership. Again to the clerk.
Thank you. Through you, Mr. Warden. This is to make council aware that we are looking right now for a community member for our Accessibility Advisory Committee. They are for 2-year terms, and we have one member who has not reoffered for the committee. So we just want to make council aware. We have put it out there, and we're hoping to get some members put their names forward. We will bring anything back to County Council at the January meeting for your approval. I'd be pleased to answer any questions council may have.
Any questions for the clerk? Seeing none, the recommendation is simply to note and receive. Councillor Fritsch, moved by alternate Hook. Any further discussion? Call the question. All those in favor? Motion is carried. Staffing reclassification. Mr. Wagger.
Yes, thank you. Through you, Mr. Warden. Currently, we have a part-time staff member in property services who has retired, and we have another one pending for June 2026. Looking at the numbers of overtime and the additional demands in our housing and property environment, staff's recommending that we reclassify the 2 part-time positions into 2 full-time positions. This will add 2 people to our on-call list, which will help alleviate the stress of existing staff on that list. So it adds 2 people into the rotation. It'll allow us to do more work without having to pay overtime and have external contractors. And then the addition of a full-time position versus a part-time is we can attract more people that would be interested in the position and applying for the County of Lennox and Addington. I'll be happy to answer any questions should council have any.
Thank you, Mr. Wagger. Questions from council? Seeing none, there is a recommendation. What are council's wishes? Councillor Wise?
Yeah, I'll move the recommendation.
So moved, seconded by Councillor Calver. Any further discussion? Call the question. All those in favor? Motion is carried. Amendment to traffic control sign bylaw. Again to you, Mr. Wagger.
Yes, thank you again through you, Mr. Warden. Essentially, we have a bylaw that identifies where our traffic signals and pedestrian crossings are. with the installation of the roundabout and the new pedestrian crossing in Odessa on County Road 2. This bylaw has to come back to council for approval, and you'll see that bylaw in the subsequent bylaw section of tonight's meeting, but happy to answer any questions should council have any.
Thank you, Mr. Wager. Questions? Can I get a motion to note and receive then? Deputy Warden, seconded by Councillor Davison. Any further discussion? Call the question. All those in favor? Motion is carried. Amendment to speed bylaw.
Thank you, Mr. Warden. Through you, we have a speed bylaw change. There was some resident concerns in Aaronsville. Staff reviewed this as per our speed limit policy and have determined that the signs should be moved back to help decrease speeds through that area, and that change is reflected in the bylaw, or proposed bylaw, which you see again in the bylaw section of tonight's meeting. Happy to answer any questions should council have any.
Thank you, Mr. Wager. Questions? Again, I'd seek a motion to note and receive. Councillor Wise, seconded by Councillor Fritsch. Any further discussion? Call the question. All those in favor? Motion is carried. Road allowance reserve bylaw.
Yes, so back in 2022, there was a severance application was reviewed by staff, and a 0.3 meter reserve was necessary along the frontage on County Road 41. When this property got registered, it got registered as roadway, and like a roadway, the right-of-way rather than reserve. So this is just to correct that and have that registered as reserve attached to the title of the property. Be happy to answer any questions should council have any.
Thank you, sir. Council, any questions with respect to the road allowance reserve bylaw? Again, I'd seek a motion. Note and receive. Councillor Richardson, seconded by Councillor Davison. Any further discussion? Call the question. All those in favor? Motion is carried. County Properties and Facilities bylaw. Again to Mr. Wager. A lot on the docket for you tonight.
Thank you, Mr. Warden. Through you, the County of Lennox and Addington currently doesn't have properties and facilities bylaw. So this bylaw is to help regulate and set guidelines for our residents and their families on county properties and within county facilities. The bylaw is really set up so that it can have input and policies set in place from our local municipalities. So right now, currently, the town of Greater Napanee has a bylaw, so you'll see that as section or Schedule A, which basically mimics the town's preferences in their bylaw with our bylaw. And I've identified a couple differences in the two bylaws, essentially from county to town. But it leaves us open to should another local municipality enact a similar bylaw, we would then bring that back and attach Schedule B, Schedule C, et cetera, as needed for each municipality. And that will help reflect the needs of the peoples within that community throughout the county. Be happy to answer any questions should council have any.
Thank you, Mr. Wager. Questions? Yeah, Councillor Richardson.
Yeah, just a brief statement, Mr. Warden. I'm glad to see that the bylaw is consistent with the bylaw that we have in the town of Greater Napanee. I was hopeful that it was going to be fairly consistent in the fact that there's enough folks out there that are confused enough with a lot of things, is that when we start looking at two different bylaws and different sets of rules, that it just confuses people. So I'm quite happy to see that it runs along or parallel with the one that we have in Greater Napanee, so thank you.
Thank you, Councillor Richardson. Others? All right, can I get a motion to note and receive? Councillor Calver, seconded by Councillor Richardson. Any further discussion? Call the question. All those in favor? Motion is carried. Building high-density social housing.
Thank you, Mr. Warden. Through you, we're at a point where staff has worked with Loyalist staff on developing a facility on Church Street, but timelines to meet the housing initiative funding that Loyalist has received are fastly, or actually they're here, they're not fast approaching, this is the deadline. So staff are really looking for council to direct staff and to see what the appetite from council is in order to develop a facility on the Church Street property. So staff has included a recommendation of up to 12 unit building, and we feel that based on discussions with staff and from feedback from town hall meetings with residents, that is the best fit to work within the community and balance the needs of the residents in that area. I'd be happy to answer any questions should council have any.
Questions, discussion. Deputy Warden?
Is Director Chenier signed in virtually? That I have a question for her, if that's possible.
Yes, I am.
There you are.
Go ahead, Deputy.
Thank you. As was mentioned, the township and the county have worked well together. I appreciate the collaboration between the two to get it to this stage. It's worked very well. As was mentioned, twice a year, the township does have town hall meetings. We go around to 5 different locations and meet with the residents. So some of the feedback that I've got, I appreciate the work that the director has answered a lot of questions and helped me through. And there was one that I just had this evening, just for clarification. And I believe the latest that I recall affordable housing that was built within the county were the 8 units that are in Tamworth. Could you just provide a little information on how the units are populated, and if there's been any, concerns or incidents that are notable that would be of concern to anyone, any other residents?
Thank you for the question. I have not heard of any concerns by any of the residents or community members. Right now, excuse me, because 6 of the units are affordable housing and 2 of the units are rent geared to income housing, there's a significant difference between the two. So the rent geared to income units, which in Tamworth there are 2, they are the person's income. The rent being charged is 30% of their income. So their rent is deeply affordable. The other 6 units are considered affordable housing, and they are a set rate of rent, and that's based on the average market rent set by CMHC. So as an example, a 1-bedroom unit is roughly renting for an average market rent of just over $1,100 per month. Affordable housing is 80% of that average market rent. So for Loyalist Township, that would be just under $900 per month would be with the rent that is being charged. So that's a significant difference between someone who's being charged 30% of the rent versus an affordable rental rate. Now, those rents are still considered affordable because they're only 80% of the average market rent. And that's what we're looking at for this high density build. And we use, because there's such a limited number of accessible units, we're giving priority to people who are living in rent geared to income housing but paying market rent. We give priority to those that need an accessible unit. So we know what their rental history is like, they're in good standing, all of those kinds of things in order to be able to be put on the internal transfer list. So those would be given priority first. And then it would be an income decision as to whether or not the person could afford the affordable rental rate versus a rent geared to income rate. Does that answer your question?
Yes, it does. Thank you.
Okay.
Others? Yeah, Councillor Wise.
Well, I can just assure that Deputy Warden Hagedorn, that there's been no incidents of disturbances or community concern of any kind. It's been nothing but peace and quiet since the residents occupied those units in Tamworth. It's problem-free as far as I'm aware. Doug, it's a success all around.
Anyone else? What are council's wishes with this? Staff are looking for direction. Deputy Warden?
I would move to receive and adopt the report, or the recommendation.
Okay. So moved. Is there a seconder for that? Councillor Wise? Mover.
Just once again to thank the county staff for working very diligently with township staff to make sure that this came around, and also very helpful through the whole process when dealing with our residents and everything, to make sure that all of the proper responses were being given and that there was accuracy all around. And I specifically want to thank the CAO. She personally reached out to a few residents that were looking for additional information, and she had it and she was able to do it. So I just appreciate all the support that's been had and look forward to progressing this project.
Seconder, any comments?
Well, just that I'm pleased that the county is making a commitment to housing, which we identified as a strategic priority, I think, a couple of councils ago, and we haven't wavered from that path, although it's an expensive path. And without more leadership from the federal and provincial government, we can't do much more, and I'd say we're punching above our weight as it is. So I hope, assuming this project proceeds in a favorable way, that the residents know what we're doing, and we get some coverage and some feedback and some appreciation for it. Not because we need our egos massaged, but just so people who are paying our taxes know that, yes, we're trying to do something about housing in the county. Thank you.
Thank you, Councillor Wise. Others? Discussion. All right, then I'll call the question. All those in favor? Motion is carried. We come to procurement policy. Mr. Day.
Through you, Mr. Warden. Before council tonight is a request to review our purchasing policy and to approve it. Per section 3.12 of our purchasing policy, it is to be reviewed by council at least once per term of council. The last time it was reviewed was June 2020, with very minor changes really to allow electronic bidding. So the attached purchasing policy was developed by finance staff, taking into consideration industry standards and in line with the KPMG process review that we had a few years ago. And county's senior leadership team has also reviewed it and approved it. So most of the policy remains unchanged. I've highlighted in the report the sections summary form of the changes. Also of note is there hasn't been a limit change to the approval limit since 2017. So I've highlighted the sections where those limits have changed, and that's to reflect obviously the increasing in prices and to reduce the administration burden for both council and staff, and it's totally in line with industry standards, and I'm happy to answer any questions that council may have. I did want to remind that during the spring when the tariffs came out, we were addressed council that we would address it in the purchasing policy, and section 8 does do that, gives you some leeway on what to do during those times that we're in right now. Happy to answer any questions.
Yes, unfortunately. Questions for Mr. Day with respect to the report first? Seeing no questions, there is a recommendation to note and receive the report and adopt the policy. Councillor Fritsch, seconded by Councillor Richardson. Any further discussion? Call the question. All those in favor? Motion is carried. Economic Development Coalition, Mr. Paul.
Okay, thank you. The Economic Development Coalition works in two-year terms, and the two-year term concludes on December 31st of this year for our current members. And typically, we would do a call out looking for recruitment of new members and bringing back to council for their approval. What we're recommending is that that we start in 2027 with a strategic review of the Economic Development Coalition, and that take place with the strategic planning process of the new council at that time. And then tied to that, we recommend the members of the public currently appointed to the committee, who are great members, remain in place for 2026 through to 2027. And they can help us with different initiatives such as the National LA Activation Fund. And we are recommending, tied to that, that it become ad hoc, that we meet up to 3 times a year and tied to specific projects that we have ongoing. And we think that'll provide more flexibility and user expertise better as the opportunity exists from an economic development side of things. So happy to answer any questions with respect to that.
Thank you, Mr. Paul. Questions? What are council's wishes? There's a recommendation. Alternate Hook, moving the recommendation, seconded by Councillor Davison. Any further discussion? Call the question. All those in favor? Motion is carried. Potential childcare expansion. We'll turn back to Ms. Chenier on screen.
Thank you, Mr. Warden. One thing I would like to correct in the report is about the library usage, and maybe Stephen may be able to speak better to that as to the usage that the library is using of that secondary space that is being used for the early on room and the community room. And other than that, I don't have anything to add to the report.
Thank you, Ms. Chenier. Questions with respect to the report? Seeing none, what are council's wishes? There is a recommendation. Councillor Richardson, move to adopt the recommendation, seconded by Councillor Wise. Any further discussion? Call the question. All those in favor? Motion is carried. Advisory Committee reports. TAC.
Thank you. Through you, Mr. Warden. I don't have anything to add or highlight to the report, but outside of the report, I'd like to take this opportunity to inform council and the residents. CP Rail Line has identified a surface defect at the Roblin crossing on County Road 41 and have requested a 2-day closure. So the 2-day closure has now been set for November 26th at 7 a.m. and extending until November 27th at 5 p.m. And hopefully that will fix the defect. They have to do some paving in that area as well, but that's the time that fits within their schedule. We did try to do a weekend so it wouldn't affect working communities and the school, but it doesn't really work for CP, so that's the dates we have agreed to. Be happy to answer any questions should council have any.
Any questions for Mr. Wager? Yep, Councillor Richardson.
Thank you, Mr. Warden. I just asked if Mr. Wager could forward any information on to the lower tiers so that we can give you some assistance with respect to notifications and things like that. Usually the lower tiers are the ones that get the phone calls on it. So if you could do that for us, I think it'd be a great help to both the lower and the upper tier.
Yeah,
Mr. Wager?
Through you, Mr. Warden. That is the plan. We've already been working and communicating with town staff. They will be actually setting up the closure for that road, and they were the main selectors of the actual detour route as it does go on the town roads. So our communication will be shared on social media, and it will be one communication from both parties.
Perfect. Appreciate that. Thank you, Mr. Warden.
Councillor Wise.
Yes, not directly connected, but certainly on the subject of flawed crossings. The CP crossing on County Road 4 at Reedville is now at the point where you virtually have to stop to get across it. I know we've had this conversation in the past. How do we motivate CP to do something about that? I know it's up to them. We can't order it, or Have we had any communication about that crossing recently, Chris?
Through you, Mr. Warden. Recently, in the last year, no. I can absolutely try again. For the farmers out there, the county of Lennox and Addington is a fly on a bull's back. They just do what they want to do when they want to do it. I do hope there's a lot more communication. We've had some good results in the past, but if they really don't view it as an issue, it's not going to get done. But we'll try our best and increase our communications with CP Rail on that crossing. But you are correct; it is, in my opinion, it needs some rehabilitation as well.
Any other questions? Mr. Hook?
I was just wondering if an ambulance coming down 41 Highway from the north, what kind of a detour and what kind of a delay they might have going to the LNA County Hospital.
So the total detour the total detour length is about 10 kilometers, but it's only taking up, so it's a 6-kilometer section on County Road 41 that's being detoured around, but it's a 10-kilometer detour. I expect that this would add approximately a minute to a minute and a half to any of the responding agencies. They have been in communication with already as part of the detour assessment, and they will have a prepared plan in place for any transfers during that time of the detour. I believe I addressed that properly, Chief?
Through you, Warden.
Chief?
Absolutely, Chris. You covered it perfectly well.
Anyone else? Can I get an adoption of those TAC minutes? Deputy Warden, seconded by Councillor Fritsch. Call the question. All those in favor? Motion is carried. Accessibility Advisory Committee.
Through you, Mr. Warden, I don't have anything to highlight from the minutes, but I'd be pleased to answer any questions council may have.
Any questions on those minutes? No cooperative railways in those minutes. Can I get an adoption? Councillor Fritsch, seconded by Councillor Wise. All those in favor? Motion is carried. JMPC Compliance Report. Ms. Malcolm.
Thank you. Through you, Mr. Warden. The admission and discharge rates, I span from July to September. You can see that we've had 33 admissions, and we've had a really good use of our respite bed. It's been used by 11 people during that time frame, and 32 residents have discharged. Exciting news for some, and certainly an enhancement for our retention plan with our PSWs. Health Force Ontario has offered a recruitment incentive for new PSWs or PSWs who have not been working in the healthcare sector for over 1 year. If they commit to a long-term care home to work a minimum of 60 hours per pay, which is 2 weeks, for the course of a year, then they will receive $5,000 after doing that for 6 months, and an additional $5,000 if they do that for a full year. So we have secured 20 PSWs through that initiative, and no cost to us other than a lovely commitment of 1 year. So that's very good. And then we will continue. They're continuing to fund this program, and so you submit your eligible PSWs who have expressed interest, and then you wait and get approval from them. And so the next cycle that is occurring will be commencing October 1st. So we'll, commencing October 1st, this just passed, so we'll have to wait to see if we get some more positions for that. In addition, for our food service workers, so if you recall, with the new Fixing Long-Term Care Act, there is no longer a requirement for these individuals in our dietary department to be certified. That was a reduction in the Fixing Long-Term Care Act. We feel very strongly that this is an important certificate that staff should have, and so we have continued to have that as a requirement. So in partnership with the Limestone District School Board, who does our PSW Living Classroom, we've been talking to them quite a bit and built the food service worker program specific to the John M. Parrott Center, but that could be transferable to other long-term care homes in this area for students to come and do the program. It's not accredited, but it's still the program. So if long-term care homes, for instance, if Village Green wanted to continue to maintain their dietary staff using the food service worker program, then they could come and do that program at our home. And follow our curriculum and receive a certificate. So this is a pilot program that will run 12 weeks. There's 6 modules, and we currently have 8 of our dietary staff who don't have the certificate, and they will go through this pilot program. You may recall last budget, we also set aside money in our budget to support our existing food service workers through that educational program. So we would pay 50% of their cost upon completion. So that's about $2,500. So this would then eliminate our need to do that, because for our staff this would be a free program then. So it's very exciting. The next thing is the Ministry of Long-Term Care compliance findings. Again, they found their way to us October 27th to the 30th, and they were conducting inspections related to 2 allegations of resident-to-resident abuse and 2 residents who fell with injury. They reviewed the protocols that I've listed there, and there was no findings at all, which is great. The quality indicators that I'm sharing with you, I'm giving you a little bit longer span of time in which to look at the data. Hopefully that will be helpful. You can see the antipsychotic use without a diagnosis. We're really proud of that one, and we will not continue to be reporting on that one for 2026. The worsened and remained dependent in mid-loss ADLs continues to be fairly unchanging, but we are seeing definite gains within our restorative care team in terms of increasing mobility, increasing independence in some care. So I think over time that will generally improve on its own. Residents who fell in the last 30 days continues to be an indicator that we are struggling with. It is dependent on the resident population that we currently have. And the residents with worsening pain continues to be, again, a fairly stagnant data point. However, our clinical pathways and the best practice guidelines are currently under review, and so I expect that we'll also see improvement there. And then the worsening stage 2 to 4 pressure ulcers continues to see really good improvements, and we're very impressed with the team that is addressing those issues. In terms of the infection control, you can see that we're at 72% fit testing of our staff. Audits were increased to 4 for the month of October, and that was as a result of a couple of respiratory outbreaks that we had in the home. And our flu shots have started with our residents. We're back up to 86%. You will see an area where we are a little concerned in that our staff are currently at 24%. That is climbing every day because we are currently doing the flu shot vaccination, but there is definitely some reluctance where there historically has never been a reluctance at the Parrott Center. There is a reluctance to the staff flu shots, largely, I suspect, due to the COVID vaccination rates. So that's all I have to say. Happy to take any questions.
Thank you, Ms. Malcolm. Questions with respect to the JMPC compliance report? Alternate Hook.
Thank you, Mr. Warden. I had a question about the influx of the PSWs, which is certainly good news. My question is, where do they come from? Are they PSWs that maybe left the workforce and you're luring them back, or are they coming from other long-term care homes?
Oh, dear. Through you, Mr. Warden. So it's a combination where I would say that it's definitely our PSW Living Classroom is primarily the candidates that are on our list right now. So that's an absolute fantastic win for the PSW Living Classroom. And then we have a few that have come from just recent grads from Loyalist College. So weren't in another long-term care home. And I believe there is just one that we have recruited from another long-term care home. So that's all in all actually pretty good.
Okay, thank you.
Others? Can I get a motion to adopt then? Mr. Hook, seconded by Councillor Wise. All those in favor? Motion is carried. Activity reports, administrative services.
Through you, Mr. Chair. Just a couple things to highlight. One, I want to thank Council for the time I was able to go to the SOLAS conference in the United Kingdom. I will point out the entire costs were covered by SOLAS and CAMA. But it really was an honor to represent the Canadian perspective on their panel. Apparently, I was the first Canadian, I think, that they've ever had on their panel or that anyone could remember, so honored by that. I really was fascinated to see that our challenges are just so similar. I was on a panel with the United States and Australia, and of course, then in the audience with all of the folks from the United Kingdom, and fascinated that our challenges are all the same, trying to stretch our budget and meet the needs of our communities. Homelessness, incivility, the pressure of substance abuse in our communities, all the same challenges, and great to share ideas and practices. But really interesting that our challenges are the same, but the governance was very different. And this one shocked me, and I thought I'd share it with you. So the conference was in the city of Leeds, 800,000 people. The council, size of their municipal council is 99. 99 municipal councillors. Like, very different structure than what we have here, I know. Yeah. Anyway, it was a wonderful opportunity, and I really appreciated it. And I'm happy to say that the work that CAMA's doing on incivility and healthy democracy, we're a little bit ahead of what they are. And we just met with them yesterday again through Zoom. We're going to help them advance their program of what they want to do for their members. So it's just kind of nice to do something to help them along because we're farther down the road on that. So really pleased. And the other thing I would like to say is to congratulate staff, and I know Tracy's here and she's involved in this, on our United Way campaign and $17,738 in pledges and from our county staff and council. Some of you have contributed. Thank you very much. That's a really great way to help the community. I'm happy to answer any questions council might have on the report.
Any questions for administrative services? Seeing none. Those local councils in the UK are also partisan as well,
Yes.
which makes them very different than our system. Financial services, Mr. Day.
To you, Mr. Warden. The one part I'd like to highlight in my activity report is the third quarter results ending September 30th are in the report. Happy to say that we are operating within the expected range. There is obviously in the fourth quarter we do get a large amount of our infrastructure services invoicing, and this council is updated on this, and we'll be reviewing that through budget as well. I'm happy to answer any questions that council may have.
Any questions for Mr. Day? Social services, Ms. Chenier.
Thank you, Mr. Warden. Just a couple of highlights. Just a big thanks out to Liam Baird and the GIS team for all of their hard work. They are launching their centralized childcare waitlist this month, and so we're really looking forward to that and being able to gather that data. And then the second highlight is on October 1st, Pellis hosted a homelessness meeting with elected officials and staff from member municipalities, where they were invited to learn more about homelessness, causes, solutions, and participants provided input into the 10-year housing and homelessness plan update that is going to be completed by the spring of next year. And it was a really good day and lots of good information and lots of ideas. And there'll be further communications and consultations coming from that. And I'd be happy to answer any questions that council may have.
Thank you, Ms. Chenier. Questions for social services? Seeing none. Community and development services.
Okay, thank you. Just a couple things to note. Our Bath Library, we're back at that location. Excuse me, there were some renovations that were done. I want a big thanks to Loyal's Township for putting in the work there very quickly to allow us to be back in that space. Further on the library side, just to kind of understand exactly what our door traffic is at the library throughout a regular month. So in October, across all our branches, we had just under 9,500 people that went through the doors of those branches. So they're busy locations, and that's significantly higher than previous years as well. A couple things on the museum. If you have the chance, there's a lot of our objects are now online, so you can go and do searches and read Napanee Beaver editions from right back to well into the 1970s and earlier than that, and then a lot of our curatorial items are there as well. So those are being used by people all over the globe, actually, who are doing research on our community and a lot on their families and the history of their families here in our county. So thanks to staff for all their work on that, and I'm happy to answer any questions.
Any questions for Mr. Paul? Seeing none. Long-term care.
Thank you, through you, Mr. Warden. There's nothing that I particularly want to highlight other than our Christmas market that we are having at the home on this Saturday from 9 till 1, and you can come and get your picture with Santa if you would like.
Thank you, Ms. Malcolm. Any questions on long-term care? Emergency services. Over to the chief.
Thank you, Warden, through you. Just one thing to note, I had the honor of being at the AGM where two of Lennox and Addington's proud paramedics received their exemplary service medal. So there's Deputy Chief Paul Osborne and paramedic Jason Turnbull. I was with them. They were quite taken back at the grandeur of the event, and they're very proud to represent our county, and I'm very proud of them and what they do every day.
So are we. Thank you, Chief. Any questions for the chief? Seeing none. HR.
Thank you, Mr. Warden. I don't have anything to add or highlight, but I'm happy to answer any questions council may have about the report.
That's always a good thing from HR. Any questions for HR? Seeing none. Infrastructure services.
Thank you, Mr. Warden. Through you, I just have one item to highlight, and that's that the County of Lennox and Addington has been selected to co-host the EGOG, the annual meeting for municipal GIS leaders. This will allow about 80 to 100 people from for the GIS leaders in municipalities and communities across Ontario to come to the County of Lennox and Addington. There's going to be presentations from county staff as well as other municipal leaders on innovation and GIS strategies across the province. And because of the recent creation of the GIS TAC committee or TAC group, this is going to be a joint host, and will be involving GIS staff from all of our local municipalities. Happy to answer any questions should council have any.
Thank you, Mr. Wager. Any questions? Seeing none, can I get a motion to receive those reports en masse? Councillor Calver, seconded by Councillor Fritsch. Any further discussion? Call the question. Motion is carried. We come to resolutions. There's a resolution before us from the Niagara region. State of emergency on mental health, homelessness, and addictions. What are council's wishes with this? Councillor Wise.
Receive and adopt, or support.
Yep.
Whatever.
Motion to receive and support.
Yeah.
Seconded by Councillor Calver. Discussion? Mover? Seconder? Anyone else? Call the question. All those in favor? Motion is carried. Matters for information, development charges. Yeah. No comments, questions on those. Number 2, Fighting Delays, Building Faster Act. Any questions on those? Can I get a motion to receive them then? Councillor Davison, seconded by Councillor Richardson. Any further discussion? Call the question. All those in favor? Motion is carried. Any statements by members? Any notices of motion? Any matters of urgency? Okay, then we come to the annual tradition of the warden's valedictory remarks for the past year. And so I want to begin by thanking council for their support in this past year. I hope it's obvious to everyone, but I have enjoyed every single minute of being warden. It has been a great honor and privilege, and I really couldn't adequately express in words how much I have loved it. As far as I'm concerned, the signal joy of being warden is that you're able to spend so much time gaining a deeper appreciation for the work that we do as county, and then sharing in the celebration of that work. So I made it a stated goal during my tenure to focus on that particular aspect, to leverage the warden's position to draw out and describe to our communities a fuller, more rounded, more positive picture of who we are and what we do. And so I don't want to make this about me. I want it to make it about us. And so I think it's important to highlight some of the things that we have accomplished as a county, as a council and staff in this year. So through our HR team, we've continued to walk the walk in making LNA an employer of choice, and we've concluded not one, but 3 successful collective agreements, showing that we continue to foster respectful, stable, and collaborative relationships with our employees and those who bargain and advocate for them. In infrastructure services, as we know, there's lots of workers quietly and busily ensuring that we hold a high standard for the maintenance of all our assets. And this year, property services significantly enhanced health and safety measures related to fire protection across our housing buildings. Over the past year, LED retrofits have been completed in both housing and county buildings. One particular example includes replacing standard track lighting with a dimmable dual lighting system, providing greater energy efficiency and improved flexibility for displaying our artifacts in the museum's lower gallery. These things may seem simple, but they demonstrate the day-to-day hard work our staff do to implement our strategic priorities as council. In this instance, like sustainability and clean energy efficiency embedded in our climate action plan. Long-term care really continues to be an area where LNA stands above the rest as leaders, as not just in long-term care generally, but among municipally operated long-term care facilities. I have particularly enjoyed a great deal of my time as warden being with Angela and her team, celebrating the many milestones of JMPC's upward trajectory as a gold standard home. Whether it's been celebrating JMPC becoming a best practice spotlight organization, or celebrating them partnering with the RNAO to complete clinical pathways, or whether it's been lauding JMPC's first graduates from the PSW Living Classroom, or even meeting with our provincial representative to discuss the impacts of legislation on long-term care. It's been a privilege to witness and be a part of these amazing successes. As we know around this horseshoe, emergency services has been a department that's witnessed a lot of change and incredible pace of strengthening and improvement in this term of council. And this past year, that pace has not slowed. With the help of the province and Kingston Dispatch, emergency services implemented the MPDS, the Medical Priority Dispatch System, to enhance the consistency, accuracy, and efficiency of emergency call triage. They've introduced stat packs, first response bags that support rapid decontamination, reducing cross-contamination risks, improving equipment hygiene, supporting safer patient care environments. To support paramedic safety and operational resilience in our northern stations, emergency services are introducing the Zoll Auto Pulse, which is a CPR device. It's to provide consistent, high-quality mechanical chest compressions. This reduces physical strain on paramedics, improves outcomes during cardiac arrest. Also, emergency services has implemented Operative IQ, a cloud-based platform that provides real-time tracking, automated reporting, and centralized control over equipment and supplies. Most notably, its adoption has already led to a 90% reduction in paper use. Again, seemingly simple, but an important building block in supporting strategic priorities. And we continue to punch above our weight in community and development services. In 2025, the museum delivered over 180 programs, 9 new exhibits, hundreds of student visits from area schools, and overall museum visits of 10,000 people. The museum was the recipient of $48,000 of federal grant from the Museum Assistance Program, and this will support a multi-phased storage inventory that'll help us better protect our artifacts. We started the agricultural lands study this year. The county official plan update is well underway. For Naturally LNA, over 725,000 people visited the website in 2025. And then, of course, there's social services, which has been in the spotlight this year, and some of that attention has been challenging. The challenge for us as members of council is to tell the story of the work social services does in our community, because we all know here how vital that work is. And like all other departments, that story too is an impressive one. In children's services, a unified application system was introduced to simplify the process for families seeking childcare and to provide service managers with reliable data for planning and decision-making. The continued implementation of the directed growth strategy resulted in the creation of 62 new childcare spaces in 2025, with an additional 120 spaces planned for 2026. In this year also, the school-age affordability pilot was launched, which targets families with children aged 6 to 12. On the Ontario Works side of social services, staff have successfully transitioned to the provincial centralized intake system, which allows for increased focus on life stabilization supports and individualized service planning. And when it comes to housing, social services has successfully managed 421 community housing units across 17 locations, with 31 rent geared to income, move-ins, and move-outs to date, has funded and supported 5 not-for-profit housing corporations operating a total of 195 community housing units, maintained 63 active rental supplement units to support housing affordability, opened a new 8-unit transitional housing site and reopened another, currently supporting 36 individuals, and 7 residents successfully transitioned to permanent housing, resolving their personal homelessness. In 2025, social services assisted 36 households through the Canada-Ontario Housing Benefit and provided additional support through the Housing Prevention Benefit. And this fall, as Ms. Chenier mentioned, Pellis hosted an extremely successful regional homelessness meeting with member municipalities and secured a consultant to complete a housing needs assessment and up-to-date 10-year housing and homelessness plan. And when it comes to mental health and addictions, social services facilitated 78 referrals to an in-house addictions and mental health worker focused on homelessness prevention. In admin services, we implemented our corporate communications strategy, which included the launch of our Helping People Live Their Best Lives tagline. Finance continues to beaver away with initiatives to better steward our tax dollars. In 2025, they began an intensive review and restructuring of the JMPC's reconciliation for our annual report. Finance and GIS have worked with MPAC to get additional assessment added when comparing data. And with the addition of the new senior financial analyst and asset management position, the county's also been able to enhance community paramedic financial reporting and budget requirements. And in provincial offenses, the backlog of court cases has been cleared, a backlog gifted from the COVID-19 pandemic. So these are just a few highlights of the many, many achievements of LNA County in 2025. As Councillor Wise said earlier when we discussed our strategic plan update, it's impressive what we do and at the speed at which we do it and the success that we have. And I am personally so proud of our county and the work that our staff do. So before I go any further, I would ask my fellow members of council to show their appreciation for our staff. And with that, again, I am so grateful to council for this honor and opportunity. I have passionately held every moment in the job with joy and gravitas alike. So thank you.
Well, it's my happy task to present you, Nathan, with some gifts. I don't know what's in these. I'm as much in mystery as you are. I will say, you said you wanted to make your valedictory remarks about the county and not yourself, but my remarks are about yourself. And I would like to say that you bring not only positive enthusiasm, but you're more than just a cheerleader for the county. You're also a very hands-on warden. Having occupied that role myself, I know about your practical involvement and the amount of thought and time you devote to all aspects of this position. You occupy it fully and successfully, and I think we've been very fortunate to have you. So, as a token of appreciation, I present you with 2 gifts. I hope you're going to open them so we know what's in them.
Thank you, Councillor Wise. That's very kind of you. So I know what is in here. It's a gavel, which is, I'm a Bluff traditionalist. It's a traditional gift for wardens. It has been in times past. Henry had one. I think it was on display at his celebration of life. So thank you for that. And I have no idea what this is. So I shall do this for council's benefit. It is my warden picture from the wall.
There's one still on
There's one still on the wall. That's good. Again, thank you, Councillor Wise, for your remarks, and again, thank you to council. And now I'm going to vacate my chair and turn it over to the clerk.
The floor is now open for nominations for the position of warden for the year 2026. Councillor Calver?
I'd like to nominate Councillor Terry Richardson.
Do we have a seconder for that? Councillor Davison?
I will second that nomination.
Second call for nominations for the position of warden for the year 2026. Councillor Wise?
Yes, I will nominate Nathan Townend for that position. And I would say I realize that it's not, although it's not unprecedented, it's not common to have a warden serve a second term, but I believe that Nathan's talents are exceptional. And having served myself on the EOWC, I know that about 3/4 of the way through your term, you start to kind of get a feel for what the EOWC is about, and then you're done. So I think we should be considering every year a second term for warden, assuming the individual is interested in that. And I think Nathan is an exceptional warden, and I'm happy to nominate him.
Do we have a seconder for that nomination? Councillor Fritsch? Third and final call for nominations for the position of warden for the year 2026. Nominations are now closed. We will ask the nominees to speak in the order they were nominated as per our rules of procedure. And I would ask that you go to the podium to speak so that we can hear you. Thank you.
Thank you, Madam Clerk. I'd like to start off this evening to thank the two councillors that nominated me for this position, Councillor Calver as well as Councillor Davidson. I'd like to welcome those that are at home watching this evening's meeting, and I'd like to thank Warden, past Warden, I guess at this point, Townen, for the service that he's provided for our county over the year of 2025. I wasn't going to go into a whole lot of background detail, but having alternate Hook here, I just want to give you a little bit of a background as to who I am and where I've come from. So I think that's important, just because I know most of us here this evening have probably heard what I'm going to say or parts of what I'm going to say, but I think it's important that you understand who I am and where I come from. Obviously, my name is Terry Richardson. I've, in my previous experiences, my job, I served 30 years in the policing field, 26 with the OPP and 4 with the Peel Regional Police. The 2018-2022 term, that was my first term of council in the town of Greater Napanee, and in this current term, 2022 to 2026, I'm the head of council of the town of Greater Napanee, so serve as the mayor of town of Greater Napanee. So just to give you a little bit of a foreground. Once again, thank you folks for allowing me to say a few words this evening. I think it's important that, and I know that most people here understand who I am and where I come from, but I think it's important for you folks to understand just how I do business. You know, when I get involved in the provincial world or the political world in the town of Greater Napanee, my number one goal is to try and be as open and transparent and fair with not only the folks that we're working with, but with the community as a whole. You know, this profession that we are in, that we call politics, has, over the course of time, I think it's fair to say, is probably eroded. You know, and there's a lot of good people in this profession that get beat up over things that, and a lot of times aren't their fault. You know, they get blamed for stuff that is either another level of government or maybe a completely different walk of life. So it's in today's world, it's become a very difficult thing to do. And what I pride myself on is the fact of being open, transparent, with respect to everything we do. I think we owe that to our taxpayers, and strangely enough, I think it's a rarity in today's world. So I think it's really important that we have to maintain that. You know, I'm a big policy kind of guy. I'm a big rule kind of guy. Obviously, coming from the background that I come from, I think it's important that we have strong policies. I think it's important we have strong processes, and not only do we have them, but we have to make sure that folks are aware of those things. I mean, those, you know, someone once said that, you know, policies and processes are our sword and our shield, and they really are. Those are the things that make us strong. Those are the things that make us powerful. Those are the things that keep us honest, right? So I'm a very, very big supporter of the processes and the rules and policies that each and every municipal government needs to have. Maybe to a fault. I try to be fair. I try to be, coming from the world that I come from, I think it's important that you have to be fair, you have to be honest, you have to make sure that everyone gets a fair shake. That's what the public expects from us, and that's what I think we owe to the public. So, you know, there's times that we think that maybe, you know, maybe we should go in one direction or another, but, you know, we have to maintain the public image that and be held to a higher standard than most people would in other different walks of life. I think it's important for municipal governments such as this, and not only this, but in the lower tiers, to stick to your core duties. Do the things that you do good, and get the heck out of the way of the things that you shouldn't be doing, right? There's good folks out there that can do really good work, and, you know, we have to allow those folks to do that work. And we sometimes think that we are the all be all and the end all, and we can do everything, but we can't. So I think it's important that we stick to what we should do, and the things that we have the ability to do, right? So over the course of the 3 years, and I can stand here and probably talk forever about a lot of different things, but I always of the opinion is, you know, we can talk about a lot of things in life and how we do things, but the proof is in the pudding of the results that you get. You know, I as you can tell, you know, I'm a street cop. I'm a blue-collar worker. I roll my sleeves up, I get things done. I come from a world where you're presented with a problem, you fix the problems, and you move on. And that's kind of the attitude or the process that I've used with our lower tier government, is the fact that when you have problems, you have issues, you fix them. You find the solutions. And if you can't find the solutions, you tell folks that you can't find the solutions, but you find the solutions. You have to find the solutions. And I can assure you that over the past 3 years at the lower tier government in the town of Greater Annapolis, we found a lot of solutions for a lot of problems. And we are faced with a lot of problems, just as all of us here tonight are going to face. You know, it doesn't matter what it is. You know, we started out in 2018 moving into, or 2022 moving into a brand new building, which forced us as a government to reassess exactly who we are and how we do business. And, you know, that was probably one of the best things that we ever did. We got all the folks under one roof. We established, we rejigged our organization, and rejigging an organization this size is not an easy task, but we were able to do it, and I think we've done a fairly well job of it, right? So, but in doing so, obviously we faced some hurdles, and we were able to overcome those hurdles. And I don't think I'd be telling tales out of school, is that over the past 3 years, we've come an awful long way with respect to our lower tier governments. And I apologize if I talked about the lower tier government, but I think it's important, because being the head of that lower tier government, I think it shows you the type of leader that I am, in the fact that we've overcome a lot of hurdles, and we were able to build, with the assistance of council, with the assistance of staff, a very good organization that is moving forward at speeds that I don't think even I had expected. You know, when I got involved in this gig, I thought, you know what, we're probably 2 terms moving in the direction that we are, and 3 years later we're here. So I'm quite proud of that. As you can tell, probably from who I am, I'm not a knee-jerk type of guy. I like to make informed, fact-based decisions. There's absolutely no hurry to make decisions, and I think you're only going to do yourself a disservice if you don't take the time, pay the attention, and make the right decisions. So. We have a very diverse county here, and it's very easy to see when you look at the map. You know, we have 4 lower tier governments that are stretched out by, conservatively, probably 150 kilometers. And so I kind of joked with some folks that I said the other day, I says, you know, there's some parts of this county that the only thing they have in common is a 613 area code. You know, it's an extremely diverse area. And in having a diverse area, we have a very diverse council. And I will just take that one step further, as I believe that having a diverse council, I think we need to have the opportunity of having a diverse head of council. It's always good to have a new, fresh set of eyes to look at things and come from a different direction. That's how you grow, that's how you become healthy, that's how you're able to move forward. And I know past Warden Townend has done a marvelous job, as has past Warden Wise, as has past Warden Hogg. You know, and each and every one of you come from different generations, come from different walks of life, come from different areas, right? And I think that's good. I think that's refreshing. I think that's healthy. And I would like to continue that trend, to be able to put another set of eyes, or a fresh set of eyes, with respect to the organization and moving the organization forward. This county has an extremely good possibility of thriving. I see that at our local lower tiers. I see that with our partnering municipalities. It should be and is an exciting time for us right now. And we need to grasp that and take advantage of that. We really do, because we're going to start seeing things within this county that we've not seen in a very long time, if ever. You know, we've got some extremely, extremely good opportunities here for not only for housing, but for industry, for both commercial and industrial, for healthcare, as we heard earlier this evening from Dr. Morrison. So it's going to be a very extremely exciting time right now. And be quite honest, I just want to be part of that. So I think I've probably used up my 5 or 10 minutes. So thank you, Madam Clerk, for your indulgence. I appreciate the time here. And like I say, initially, you know, any one of us around the horseshoe here can do this job. We wouldn't be here if we couldn't. So I think that's important to remember. And I thank you for your time. And I'll move out of the way for past Warden Town.
Thank you, Councillor Richardson. Friends, colleagues, simply, transparently, I'm asking Council to give me the opportunity of another year to continue this work. The role of Warden is more than ceremonial. It's continued to gather and garner substantial responsibilities. And I've reflected on the past year of having done the job, and in the effective discharge of the Warden's duties, there's 3 things incumbent upon them that I think are worth highlighting: devotion, leadership, and advocacy. So to the first, devotion. Now, all of us here come to the horseshoe ready to consider the best interests of the county as a whole, all of us. But uniquely, the Warden has a profound responsibility to be the one person for whom there can be no doubt, no wavering in their having the county's interest above all others. I hope to colleagues that I've demonstrated to Council that fundamental loyalty and devotion while occupying that chair. And leadership is a broad term. It can be expressed in a myriad of ways. Councillor Richardson just alluded to that. It tailors itself to the individual, whoever the individual is. But the Warden needs to show leadership around this horseshoe not simply by conducting a good, orderly meeting, but by developing relationships with colleagues, relationships built upon trust, trust in the Warden's devotion, of course, but also trust in the Warden's commitment to equity, that everyone's voice is respected, that their needs and their commitments are understood, valued, considered. That particular trust in the Warden's leadership becomes essential when challenges arise, when disagreements appear, which thankfully are infrequent among us. But the Warden has to be able, nevertheless, to chart a course through rough waters, has to be able to have difficult conversations, but still maintain and defend the good humor and collegiality that are really the cornerstone of effective governance around the county table. The Warden also needs to show leadership in supporting staff, and this happens in a variety of ways, what I call on stage and behind the curtain. On stage, in today's political climate, it's become more necessary and important for the Warden to stand in front of staff, to protect the bargain in our democratic system that provides for the permanence, political neutrality, and privacy of those in our public service and government bureaucracies. Staff need to know that the Warden has their back, stands up for them, truly supports them. That's in more serious terms. In lighter terms, the Warden needs to support staff by attending their events, celebrating their milestones and achievements, taking an active interest in their work, working to understand it and their specific needs. As I said earlier in my valedictory speech, that's one of the most enjoyable parts of the job. And behind the curtain, there are particular staff who need to have a unique abundance of confidence in the Warden's leadership. And the 2 of them are right up there. As the heads of council around this table will know, the relationship between CAO and head of council is extremely important to the functioning of the corporation. It's challenging for any county CAO because the wardens change often. But that means a challenge of leadership for the Warden too, because they must quickly develop a relationship with the CAO and clerk that rests on the very same foundation of trust that I described. The Warden needs to be available all the time for a phone call, a text exchange, an online or in-person meeting to conduct issues management and triage, offer candid advice, provide emotional or mental health support, make political representation to external stakeholders and orders of government. Lastly, the warden has an important role to play in advocacy and external representation, and there are a variety of contexts in which that takes place. One important one is the Warden's Caucus. Of late, the EOWC has gone from strength to strength as a respected leader in the municipal advocacy world and in becoming really the voice for Eastern Ontario. Member wardens don't just provide governance to the organization, they and their CAOs in particular are expected to do the lifting of policy development and advocacy for the organization as a whole, which can be tough to do, as Councillor Wise said, for wardens who are only there for a year. Now, in my short time on the Warden's Caucus, I've developed good working relationships with fellow wardens, and particularly with the current chair, Bonnie Clark, Warden of Peterborough County. At the chair's personal request, I've attended several speaking engagements, seminars, and events representing her and the EOWC as a whole. Recently, in October, I attended EOWC's Advocacy Days on Parliament Hill in Ottawa and was part of 5 delegations that particular day with key federal stakeholders, and in every single one of those delegations, I was appointed the political lead to facilitate the discussion. I understand the EOWC's work, their profile, and as a member of the Roma and AMO boards, I've thrown myself hard into the work of municipal advocacy, helping move the dial on some of the larger issues we share in common across the province, which can be a slow and long process, as we know. But I understand that context well and can apply myself efficiently and effectively within it. I believe I've done so at EOWC, representing LNA. Now, not that it should be the salient consideration for colleagues, but I would submit for consideration that affording me another year as warden would be positively received by the EOWC. I also know that I would have the support to run for vice chair, and if successful, would be the first from our county to do so. Regardless, suffice it to say, I vouched to you when I stood here this time last year that I would represent LNA at EOWC in a way that raised our profile, augmented our contribution to the organization, and helped punch above our weight. I believe I've delivered on that and would like to continue to deliver even more given the opportunity. Closer to home, I've worked closely with our administrative services team to deliver on my promise to you to leverage the warden's role in raising the county's profile and to help the general public become more aware of the important work we do, which remains a passion of mine. I would like to continue that work in 2026 and further leverage my professional training to create a communications infrastructure for the warden's office that includes an online presence. As we certainly know at our lower tiers, a consequence of the professionalization of political communications and marketing has meant that the public expect a high degree of accountability and meaningful relationship with their elected officials and political leaders. And that's greatly mediated online. I want to ensure that whoever my successors are or will be, that there are means in place to enable them to effectively connect in their own unique way to improve interaction with the public on the county's behalf. One of the unique advantages I have had is in not being a head of council at my lower tier. What this has meant, very simply, is that I've been able to devote considerable time to the role of warden, more so perhaps than I could reasonably be able to be expected to do as a mayor or reeve of one of our lower tiers, knowing, as I do full well, the weight of responsibilities that they bear. All this is to say simply that in terms of time, dedication, and devotion, I have more that I can give and that I would like to give. In closing, I humbly submit to you, Council, my desire to serve you as warden for 2026 with the same devotion, leadership, and advocacy that I hope I have demonstrated in 2025. And come what may, regardless of that outcome, you may always be assured of my love and respect for this place, its people, and those whom we all serve. Thank you.
And just as a reminder, the voting for the position of warden will take place at our inaugural meeting on December 10th.
Okay, now to close us out, we come to bylaws. Number 1, traffic signal amendment bylaw, 3 readings. Councillor Fritsch, seconded by Councillor Calver. Any further discussion? All those in favor? Motion is carried. Speed limit amending bylaw, 3 readings. Councillor Wise, seconded by alternate Hook. Any further discussion? Call the question. All those in favor? Motion is carried. Road allowance reserve bylaw, 3 readings. Councillor Richardson, seconded by Councillor Davison. Any further discussion? Call the question. All those in favor? Motion is carried. County properties and facilities bylaw, Deputy Warden Hagedorn, Councillor Calver. Any further discussion? Call the question. All those in favor? Motion is carried. Trespass bylaw, Councillor Calver, seconded by Councillor Fritsch. Any further discussion? Call the question. All those in favor? Motion is carried. Confirmation of proceedings, Councillor Wise, seconded by Councillor Davison. All those in favor? Motion is carried. And can I get a motion to adjourn? Deputy Warden, seconded by Councillor Wise, enthusiastically. All in favor? Motion is carried. We are